Hello everyone, it is Professor Lee. This is part 1 of the Chapter 1 lecture for our Anatomy and Physiology course. So we begin the course lectures and the textbook with the structural levels of organization. So these notes are definitely basic compared to the ones that you are probably going to want to take from this lecture, from the PowerPoint. This is mostly just to kind of guide you through the overview of each section of the chapter. So anatomy is the structure of the body. It is the things that you can see, the things that you can feel most of the time. So muscles, bones, bony like prominences or dips in the bone or things like that. So it is the structure of the body, all of the body parts, if you will. And physiology is the function of those body parts. So oftentimes we can't see the physiology, although sometimes we can. If you bend your arm or you write, you can see the structure of your body performing a function, which would be the physiology portion. Pathology is the study of diseases of the body. You guys will take a Medic 236 course where you will learn all about different pathologies throughout the body system. So we're not going to get into that too heavily here, but just kind of keep in mind that pathology is the study of the diseases of the body. All right, so organization is the most important characteristic of body structure, so of the anatomy of the body. The body as a whole is a unit that is constructed of the following smaller units. So we're going to start at the smallest unit, and that is an atom and a molecule. Those are on the chemical level. Cells are a little bit bigger than those. They are the smallest structural units, and they include organizations of various chemicals and different things like that. Then we have tissues, which are organizations of similar cells. So basically, after that, we have organs, which is the largest of the, I'm sorry, not the largest. We have organs, which is the different kinds of tissues that together form an organ, and then from there we have systems, which are organizations of many different kinds of organs. So starting at the bottom, you have all these atoms and molecules, and you get enough of those together, they start to make some cells. Cells get together, they start to make tissues. Tissues get together, they make organs, and then the organs all get together and make systems. And so atoms are the smallest, and molecules are the smallest, and then body systems are the largest. So for terms of direction, these are very important whenever you are referencing the body. Now, you should have learned these in MedTerm, but if you are a student who is taking MedTerm concurrently with Anatomy and Physiology, these are going to become very important to you in both courses. So the anatomical position is a reference position in which the body is standing erect with the feet slightly apart and the arms located at the sides with the palms turned forward. So that's important. And it's important because the anatomical position gives meaning to the directional terms that we use to reference different parts of the body. And all of those directional terms are going to assume that the body is in the anatomical position. Okay, so now that you know what the anatomical position is, we are going to look at those different terms of direction. So before we get into those, I'm going to scroll down and show you this guy down here. This is a male model, a male anatomical model that is in the anatomical position. So you can see that his arms are to the side, feet slightly apart, palms forward. Now, one thing I do want to mention is that when you are looking at the anatomical position, your directions are going to be, your side is going to be opposite what the model side is. And so if I'm looking straight at this anatomical model, my right side is over here, my left side is over here. Now, what you need to be able to do is to flip yourself around in your head into the anatomical position, or physically if that's what helps you, because this is actually the model's left side and this is the model's right side. And so that's what I mean by it's kind of reverse from when you are looking, standing straight in front of a patient and looking dead at them. Your right side and their left side are going to match up and vice versa. So you're going to want to make sure that, if you have an order to perform a procedure on the right arm, that you are in fact putting yourself into the anatomical position and making sure that you are doing the procedure on your patient's right arm and not on the side that is closest to your right arm, if that makes any sense. Okay, so these directional terms, you have superior, which is toward the head, upper, or above. So the example I've given here is that the waist is going to be superior to the knee. If you look down here at your model, the waist superior to the knee. It is above the knee or more towards the head than the knee. Inferior is the opposite of superior. It is toward the feet, lower, or below. So if we imagine that the belly button is right here, here's this guy's breasts, and so the belly button here would be lower than where the breasts are located, and so that is inferior. Anterior is front or in front of. It is also the same thing as ventral in humans. So the example that I've given here is that the face is anterior to the back of the head. So the face is in front of the back of the head, which makes sense because it's the back of your head. Posterior means back or in back of. It's the same thing as dorsal in humans. So the example here that the spine is posterior to the ribs. So if you can feel your ribs on the front of your body and your spine on the back, you know that the spine is behind the ribs, and so it is posterior to the ribs. Now, one quick note about posterior: sometimes you will hear people say it posterior. It's the same thing. I was taught to say posterior. It's a Midwestern thing, I think. I don't know, but here I hear a lot of people say posterior. So whatever way you want to say it, it's the same thing. Medial and lateral are the next set of opposite terms. So medial means toward the midline of a structure. The example that I've given here is that the elbow is medial to the mediastinum. The mediastinum is this area right here in the center of the chest, and so then there's your elbow, so that would be medial. And lateral is away from the midline or toward the side of a structure. So in this example, the fingers are lateral to the mediastinum. So if you're looking at the elbow and you're looking at the fingers and you want to know which one's medial and lateral, fingers are going to be lateral because they're farther away from the mediastinum. The elbow will be medial because it is closer to the mediastinum. Proximal and distal are the next set of opposite terms. Proximal is toward or nearest the trunk or nearest the point of origin of a structure. So this is your trunk. If you cut your arms, legs, and head off, you would have your trunk left, which seems morbid, but that's how I remember it. So if you cut all of the extremities off and cut yourself off, cut the neck and head off, this is your trunk. And so you want to, when you're thinking about proximal, you want to look to see if it is nearest the trunk or farthest away from the trunk. And the other thing to consider is nearest the point of origin of a structure. So if we look here at the hip, we have, if we're looking here, proximal would be toward or nearest the trunk. So this ligament that is given here, that I put this example on here, is closest to the trunk, so that would be proximal. And then this muscle down here would be distal because it is further away. Ooh, I made that all blue. Further away from the trunk. Superficial and deep are the last two. Superficial means it is nearer the body surface. So for example, the epidermis is superficial, and deep is further away from the body surface, which means that in this case the intramuscular tissue is deep. So I've removed all of the skin from these anatomical models, and so you don't see the epidermis because I've taken it away and shown the deeper layers underneath. And so this intramuscular tissue here, you guys will learn when you get to injections that you have to use a longer needle in order to get down into the deeper intramuscular tissue. So to do IM injections, you need a much longer needle than you would for the subcutaneous, which is the fatty layer injections, or the intradermal, which is the skin deep epidermal layer injections. All right, so finishing up this part one, we have body planes. We have the sagittal plane, which is a lengthwise plane that divides a structure into right and left sections. There is a little subset of the sagittal plane called a midsagittal plane. It is a plane that divides the body into two equal halves. So if you cut a person in half right down the middle of them from the top of their skull, and the cut would actually end in the genital area, that would be a midsagittal plane. But any plane that divides the body into lengthwise into right and left sections is going to be a sagittal plane. You also have the frontal plane that is sometimes known as the coronal plane. It is a lengthwise plane that divides a structure into anterior and posterior sections. And so here, this pinkish structure, if you took a person and sliced them in half from the middle of their skull all the way through the front and the back, that would be a frontal or a coronal plane. And then lastly, we have the transverse plane, and that is a horizontal. So you can see it goes side to side, not top to bottom. A horizontal plane that divides a structure into upper and lower sections. So top half, bottom half. Now it doesn't have to be right in the middle of the body. It could be dividing the head into upper and lower sections, dividing the arm into upper and lower sections. You can put transverse planes, anywhere to divide a part of the body. All right, so that is it for part one, and part two is coming up.